All right, well, thank you, Dr. Benjamin, for an amazing introduction, and welcome to the 5th annual America Dissected live from the American Public Health Association annual meeting. Give yourselves a round of applause. As always, I'm your host, Dr. Abdul
And I'm your co-host, Dr. Katelyn Jetelina.
Katelyn, we are at APHA in what is either the beginning of the new dawn or something else. How does it feel to be at APHA just about now?
It's our people.
I know.
Our people are here. Public health. Yes. I'm so excited to be here. It's been a few months, right, guys? Like, it has been heavy. And I can't think of a better time to get together with people. I know we're just in this magnetic storm. It's really hard to find a North Star right now. One thing that helps me find a North Star is like actually seeing people and brainstorming. I think also, the best antidote to fear and destruction is joy and laughter. And so I know we're all having really tough conversations right now, but I also hope we have fun here too. We all deserve it. We all deserve it. Yeah.
Well, on that note, nothing says fun like Washington, D.C. in 2025.
We can make it fun, Abdul.
We are bringing the fun from all of our different. Speaking of, I hear we're about to have a ballroom at the White House soon.
We could have done the taping there, huh?
We could have. Maybe they'll let us use it. Anyway, no, but in all seriousness, the experience of the last couple of months, and by couple of months I mean specifically 10 months, has been this experience of almost being gaslit. Yeah. Because I don't think anybody went into this work with the idea of like, you know what, I can't wait to train really hard, learn a lot of things so that I can make a lot of money and cash out. We did this because we wanted to learn how to protect our fellow human beings. And the hard part about it is having watched a bunch of people who really have cashed out try to tell us that somehow that's not what we're doing. And that, I think, has just been really frustrating. And I think the antidote to that, to your point, is being able to be in community with folks who really are out there in all of these different places in the country doing critical work and hearing about the work they're doing and reminding yourself that that is what we all came to do, and coming together to remind ourselves that actually like we're on the right side of the broader fight for the public's well-being.
Yeah, I not only didn't get into it for the paycheck, I also didn't get into it to be like directly attacked either. If you asked me 5 years ago, I don't think public health would have been the thing. But it is where we are today. And like you said, we keep doing the work. We keep doing it. And we continue to fight for American health. And I could not be more honored to be at APHA this year.
One thing that I think, to your point, Katelyn, both you and I sort of do very different parts of this work. But that question about what it means to stand up and to fight back, I think is particularly important now. And we're going to be hearing from a guest who did exactly that later on in the conversation. But I do want to update folks, and we haven't had a conversation in 3 weeks, so there's, not
much has happened.
Yeah, not much at all. Where do you want to start?
I mean, elephant in the room.
Yeah.
Right? Government shutdown. SNAP. 1 in 8 Americans last week did not know if they would have money coming November 1st to actually feed themselves with SNAP benefits. 11th hour, though, 2 federal judges kind of came in and said, you must use these emergency funds from the federal government. Great, right? I think that there's 2 challenges with this. One is disbursement still didn't go out November 1st, right? And we're actually not entirely sure when it's gonna go out, even if it's coming. And not all people on November 1st get their SNAP benefits. It's rolling throughout the month. It depends on, like, in one state, your social security number, in another state, your last name by alphabetical order or something like that. But So the more days that we don't have, the less SNAP, or the more people that don't get their SNAP benefits, $190 per month. I think, and this is the first time in history that SNAP benefits didn't go out at the first of the month. I think the second thing, and we can see it in the data. I actually just pulled, I'm such a nerd, but I pulled this graph.
We all are, safe space.
I know. Wash U did this incredible graph. I'm going to include it in my newsletter tomorrow, that showed 211 calls for food pantries, and it increased 97% on November 1st. And it literally, it gives me chills. People are trying to figure out how to feed themselves in this deep uncertainty. I think the second thing we can't forget about SNAP is that this emergency fund is $6 billion, and we need $8 billion. And I'm not entirely sure where we can find $2 billion in the interim. I know a lot of people are putting a lot of campaigns together, which gives me hope and community. But we need our federal government working.
To the point, I just set the context here. Right now, the government is shut down over the cliff that millions of Americans are about to face in their ACA premiums. That's what this fight is about. And to your point, the first time SNAP benefits didn't go out is a function of a choice that the federal government made to specifically withhold food aid from people over a fight over healthcare aid. Meanwhile, to the earlier point, there is a new ballroom being built.
Yeah.
At the White House. It's very much a let them eat cake moment. And the hard part about this is we're headed into the holidays. This isn't just a random time of the year. This is a time of the year that people come together around food and around each other. And this is, to your point, the $6 billion that is supposed to hold us over may not be enough to hold us over. And the other part of this is that while SNAP, in theory, depending upon how the administration responds to the judge's order, may be saved, there are other programs that we often take for granted. So, WIC is a program that right now is critical for literally providing formula for babies and food for either pregnant or postpartum moms. And that WIC funding is frozen. And, I used to run a WIC program, and that is going to be catastrophic for a lot of these families. And this is the point, right? Is that this is baked into what we think of as a social safety net, but it's how we do business as a function of so many other issues about how we produce food and how we pay for it that has gotten more unaffordable for so many people. And so it's literally just horrible after horrible after horrible. And the idea that you would use food for moms and babies and poor folk as a chit in a debate about healthcare for relatively low-income folk,
it's new level.
It really is.
And a lot of our colleagues, right, even beyond the safety net, are not getting paychecks right now. A lot of my friends and colleagues are not getting paid right now, and have been through incredibly traumatic 10 months, and now here we are here to add to the pile. So
if you flew here and are flying back, just thank the folks at TSA. As an Arab American man, I'm not one to always thank the TSA folks. I somehow happen to be the one who always gets picked up, so I get to know them pretty intimately. But
it's not random?
No, but thank them, because they're out here doing the work and they're not getting paid. That's the hard part, right? All of the federal workforce, many of you, I'm sure, in the same boat, but these are folks who continue to show up. And then the last point is this, right? They're using the cloak of darkness to potentially come for folks' jobs in the forms of reduction in force. So, it really is, it's tough, because we talked a little bit about this. We didn't get into this work to fight, right? Most of us who got into public health didn't get into it to fight. But I think sometimes, right, we take for granted that these engagements, this conversation, is sometimes not had in good faith. It is not good faith to withhold food from poor people. That's not good faith, right? Whatever the political fight is. And sometimes I think we in public health, we assume that the debate is what they say the debate is. And I think sometimes we need to recognize that when we step up to fight for the public's health, right, that's going to be a fight. Like you got to be willing to eviscerate the other argument, and you've got to be willing to hold tight for your own. And I just think that we need, the faster we develop that muscle and are willing to call what is happening, I think the better off we are. All right, so that's not the only thing that's happened. We talked a little bit about this, but you've got the echo of Doge happening at ONB, and we've seen 20,000 jobs cut across HHS, funding cuts to the tune of $4.5 billion. So even if you don't work at HHS, if you were funded by HHS, there are consequences there. And the hard part about it is, even in the cloak of this darkness, you're talking about another 950 HHS staffers who are losing their job. What are the lasting implications, as you see them, Katelyn, of how our public health system hobbles forward?
I don't know. I think that's like the billion-dollar question, or multiple billions
Many
dollars.
billions of dollars.
I mean, I think that it is very clear we are seeing the absolute destruction of public health right now. And it's going to be a dark period. We're in a dark period, and I think it's going to even get darker. And I think it's going to be a while. And I think that like you said, that there's strategies, right? We need a defense right now. We also desperately need an offense of where we're going to go, how are we going to reimagine this, and where I start thinking is that once all of the rubble is on the ground, and it's going to be there, there's going to be an opportunity to rebuild, and there's going to be an opportunity not to just rebuild what we had, but rebuild for better. Because if we're being honest with ourselves, like truly honest with ourselves, our public health systems were made for a different time, and they need to be made for the 21st century. And I think that we need to keep that hope alive. That's what I'm trying to do, that there will be an opportunity to rebuild, that we can reimagine this, and that this is a marathon and it's not a sprint. And I'm just trying my darndest not to get burned out in the moment.
It's only been 10 months.
I know. No, it has not just been 10 months. I will correct. It has been 6 years
Fair point.
of like 2,000 miles per hour, trying not to crash into the guardrail. I know you know this, but like trying not to crash into the guardrails. And it is exhausting. And I think that we need to keep that perspective alive, that this is not normal. Like what we are going through is very traumatic, and it's okay to like take a break and then get back in the arena. It's okay to cry. I mean, how many times have I cried over the past 10 months? But also to keep getting back up because public health is needed, right? We're here for a reason. We got our training for a reason, and I still believe that.
Yeah. Another story on the healthcare front, we touched on this quickly, was the fact of what this fight is actually about. So in the big, ugly bill, there was a stripping away of subsidies for the Affordable Care Act marketplaces. And many of you have probably gotten a notification from your employer about your benefit selection. If you're on the marketplace, you get that same email right around October or November, and you got to pick what your benefits package is. And what we've seen is that the pulling away of these subsidies means that the price of a premium on the ACA marketplace is about to spike between 30 to 50, in some cases 100%, for 25 million Americans. And the hard part about that is this: as those marketplaces become less sustainable, you're going to start to see a lot of the providers pull out of the marketplace itself. That's happened already in Michigan, where I'm from, insurance marketplace. Yeah. So you have 3 providers in Michigan that had been party to the marketplace. They were offering ACA marketplace products. They just announced that because these subsidies have been cut, that they can't actually offer any affordable options, so they just pulled out. So I want you to think about what the implication of that is. Once they start to pull out, a lot of these folks are going to start to have to look for other options, and they may not find them because what else is coming? Medicaid cuts. So now these folks don't get access to primary care in any real way. They still need health care. And in our country, if you show up in an emergency room and you need care, you get that care. But the cost goes somewhere else. So my worry is that this becomes the beginning of a profound unraveling, right? Economists call it adverse selection or like a death spiral in the insurance marketplace. And for me, I wasn't as worried until I saw that there was only going to be, in effect, one provider in the whole marketplace in Michigan. And that's probably happening across the country. So this creates a really, really challenging set of circumstances for hospitals themselves, right? Because at some point, I've been up and down my state over the last several months, and like we watched as one of the rural hospitals in the Upper Peninsula in Michigan closed down abruptly. But like at some point, these folks are going to find it unsustainable. And I think that the thing we sometimes don't appreciate is the reason rural healthcare or rural hospitals often shut down is because if they can't operate at profit, there's still value in the real estate. And so the system will say, you know what, like just shut down the operations of the hospital, we could sell this thing for parts. And I worry that that's going to be the beginning of the end. And I worry that it's happening even faster than we countenanced because the Medicaid cuts aren't coming until rather conveniently after the midterms.
America Dissected is brought to you by Quince. Cold mornings, holiday plans. This is when I just want my wardrobe to be simple. Stuff that looks sharp, feels good, and things I'll actually wear. For me, that's Quince. And the bonus? Quince pieces make great gifts too. This season's lineup is simple but smart and easy with Quince. $50 Mongolian cashmere sweaters that feel like an everyday luxury and wool coats that are equal parts stylish and durable. Their denim nails the fit and everyday comfort, all at a fraction of what you'd expect to pay. By partnering directly with ethical factories and top artisans, Quince cuts out the middleman to deliver premium quality at half the cost of other high-end brands, so you can give luxury quality pieces without the luxury price tag. Like I've told you, literally my favorite item of clothing is my cashmere hoodie. It's soft, comfortable, and fits exactly the way you'd want. I don't want to ruin it, but I'm gifting one of these to almost everyone I love this season. Give and get timeless holiday staples that last the season with Quince. Go to quince.com/AD for free shipping on your order and 365-day returns. Now available in Canada too. That's QUINCE.com/AD. Free shipping and 365-day returns. Quince.com/AD.
One of the things that we're all talking about, these tax credits and what's happening with the subsidy, and I think what I'm missing and what I am like craving more of in this moment is just talking about how utterly insane the broader health insurance system is in the United States. And like, why can't we really own that platform? And what does that look like? And how can you like speak to it loudly? And I know you're smiling, Abdul.
I swear there are people who are trying.
I know you are, yeah. But I mean, I think that this is a topic that across the aisle, you know, you get spiraling debt. You have these increase in prices. You have the pharmaceutical industry prices. I just feel like it is a rallying topic that we could really get behind. I would get behind it. This is absolutely insane.
So I've been up and down the state talking about exactly this question. I'll just a statistic to throw out there because it's just astounding. The medical debt in this country is $225 billion. That is more than the gross domestic product of half of the states in the country. So medical debt is like this unsaid thing. And to make things even worse, the administration just used the Consumer Financial Protection Bureau, who is implicit in the name, supposed to protect consumers and their finances, has just re-instructed that medical debt can now appear on your credit report, which was taking that off credit reports was one of the key CFPB wins of the last administration. So like, think about who wins with that. Like the only people who win are creditors. Wall Street, literally, stop to Wall Street. And everyone else loses. And when you're talking about that much medical debt, like this becomes an issue that should be astounding to us. 2/3 of people who will get a cancer diagnosis will go bankrupt. So like when you get cancer, you got cancer. And then literal insult to injury, 2/3 of the time you will also lose your life savings in the richest, most powerful country in the world. It is like an insane thing.
And we wonder why we're not getting healthy again.
Yes. I'm waiting for somebody to make an ad that just to get us to our next issue, which is like, they have Maha. I'm waiting for like Maha'a, which is like make America healthy again, which is just imagery of everybody's grandparents waiting in line for a Salk vaccine in the 50s.
Yeah.
Right? Like, that's what we used to do. And here's the crazy thing. Imagine at that point, people would like literally just line their kids up for a vaccine that didn't exist in a time where vaccines themselves were actually just not as safe. We didn't have as much evidence behind them because everybody kind of knew that polio was really bad. Everybody knew somebody who had suffered because of polio. I think we've kind of forgotten what all these things actually mean, or they're just not as visible. Because when we talk about medical debt, it's not visible. Like, you don't carry your medical debt on your face. People don't know how many people suffer like they do. And so it allows this thing to stay subterranean in a way that I think is really damaging to our broader conversation about healthcare.
Well, yeah, beyond healthcare too. I mean, this is the problem with public health, is that we are the invisible shield.
Yeah.
And we actually pride in ourselves in that, right? We have these sayings of, if public health worked today and it saved your life and you didn't even know it. And I mean, I think I'll put like my comms hat on, is that like, this is the time to make the invisible visible.
People got to know it.
People have to know it. They have to feel it. They have to see the heart in it. They have to see themselves in it too. And this is really hard to do with prevention, right? But I think we need to think of innovative ways to do that. We need to be out there. We need to be fighting for the people and making it very clear we're fighting for the people and not necessarily fighting for the institutions.
And to your point, you can't monetize prevention.
But there is an ROI. That's a great talking point. If you're ever talking to a governor, return on investment.
The return on investment is clear, but it's born for the future.
Correct.
By an unnamed group of people. Whereas, like, I used to do this with students when I used to teach. I was like, imagine I'm selling you 4 MRIs for $500 a piece. Would you buy? And most people are like, no, I don't have $2,000 disposable income, and I don't need an MRI, which is the logical answer. And then you say, okay, now the next day, you're playing basketball in the rec center, you cross someone over, you feel a pop in your knee, and you come back to me and you say, all right, I heard you were selling 4 MRIs for $500 a piece because those 4 are cheaper than the 1 MRI I now need for my knee. And I'm like, no, I'm so sorry. I'm selling you 1 for $3,000, even though I could have sold you fewer. Who's gonna buy? Almost everybody says, I'm gonna buy. But then think about it. Like, the thing we actually want is not that we get an MRI after we are sick. So if I could give you like a magic wand instead of that MRI, and I could go back to the moment right before you crossed over your friend and popped your knee, and you could just like pull up J, no pop, which would you pick? Everybody picks going backward. And so the hard part about prevention is you only want it after you can't have it anymore.
Retroactively.
And you can't sell it, right? That's the problem. And so we have to figure out how we are willing to do things collectively. And the last point is also this. We are living in a society where we've gotten far less comfortable with one another. And it's not just the time issue and the ability to sell it. It's also the fact that it requires us to do things collectively. So like, we all got to give something for the greater benefit, but you don't actually know who accrues the benefit. It's impossible to know in the front. So like, we've got to get real good at telling these stories and also building community around the well-being we all kind of want to share together. And the hard part I think we have is we sometimes, like when we talk about this, we still sell what we do within the frame of health care, but that frame is not going to get people where we want them to go, you know? And so like, I think we've got to start telling the story of health care in the frame of public health. And I think if we can start doing that, we've got a much better story to tell. Because right now, people understand their costs. They understand that that is falling on them directly because we built a system where we rely on people selling stuff for you to get healthy again after you've already been sick. And chances are, increasingly in America, you're probably not going to be able to afford it. On the vaccine landscape.
Can we have happy topic after this.
We'll get to a good conversation, I promise. But like, you've been tracking the vaccine landscape. There's been a lot of movement.
Insane.
Walk us through, like, can you still get vaccinated in America, Katelyn?
You can. It is still there. I don't know. You know, when RFK was sworn in, I actually didn't think he would actually turn over the ACIP. And when he did that, I was like, I immediately was like, here we go. And there's no holding back. And there hasn't been holding back really at all. And there are like true anti-vaxxers in ACIP right now. So far, little changes, right? Thimerosal out of flu vaccines, MMVR taken off the market for little kids. That's about it. I don't think that they're done though. I mean, we've heard conversations around Hep B. We've heard conversations around HPV. We've heard conversations around all of these types of the routine childhood vaccination schedule. So I don't know what they have up their sleeves. I will say, I'll put in hope here, is that like one of the things that has been incredibly hopeful to me, at least, is seeing how many people have come together to fill in the gaps of the federal government, and like really freaking fast. So we have, VIP, which is looking at collective evidence. We now have a journal that is going to replace MMWR for field notes. We have professional organizations coming together and collaborating and communicating with each other, which is incredibly refreshing. We have even insurers coming into the conversation around, well, as they should be, covering free vaccines no matter what happens at the federal government. We have communicators. I mean, it's truly a team effort. It reminds me of COVID, where it was like an all hands on deck response. And so it's been really interesting to see how, given the dominoes falling in the federal government, how we're actually creating a parallel track that we're going down. And, one thing, I'm curious about your thoughts here, that I am concerned about with that though, or the limitation, is that we still need a federal government. And my concern is in 3 years, Republicans may come back and say, hey, look, you didn't need it in the federal government in the first place. You guys kind of filled all the gaps outside of the federal government. And so I think we still need to start communicating how this is suboptimal, how this isn't ideal, as well as start thinking through what are those systems we would fix in the future.
I hope that whoever's building this alternative MMWR names it Mortality and Morbidity Weekly Review, and it can stay MMWR. I'm just saying, like, whoever's doing it, it's a thought.
New England Journal of Medicine Evidence Review?
Oh, boo, why? We need better
something
names.
Like that.
Also,
we need better branding.
Yes, way better branding.
Yeah.
Or it's just MMWR without any name. I will say this. I actually think that a lot of the bad news around vaccine policy is going to be muted.
Muted?
Yeah. And the reason why is I think, the president is a creature of immediate feedback. And I think he has this curse that is a blessing, which is he cannot listen to something being said and be there and not one up everyone. So when they falsely connect Tylenol, when there was the attempt to just maneuver a falsehood into public consciousness, he couldn't help but take it all the way there and overstress the message and overtorque it all. And I think the immediate feedback he got was really quite negative, and he looked like a fool. And I think because he can't possibly countenance that anything would be his fault, he's probably had some really hard conversations with RFK Jr. And I think what's probably going to happen is the things that we're going to see are going to be done under cloak of dark, but they're not going to be very loud. And I think you're also probably going to see a bit of a dampening around a lot of like the next steps, because I think he thinks it's gone too far because of his own quirks of personality.
I mean, we already saw that the last ACIP meeting. right? The entire COVID discussion was of how COVID vaccines are killing us. And then they go around and vote for everyone over 6 months and old have a COVID vaccine. Like, try to make that make sense unless something's happening in the background. I just think, and I hope you're right. I hope that there isn't anything. I just don't think that RFK can help himself. I think he has this worldview so baked in that I think he's going to still overplay his cards. But we'll see.
You know, it's interesting. The question is ultimately what he sees his political future as.
Yeah.
I think if you're RFK Jr. and you think you're like, you've always been the black sheep of the Kennedy family, and you're going to show them, you need this role to be able to run for president, which is what I think he wants to do. And I think if he overplays his hand and gets fired, it's over for him. So I think he's going to do whatever it takes for him to stay in the role. And I think it's been interesting watching a person like that have to cave to a bigger narcissism than his own. Right? Because at the end of the day, like, he's the president and he's got a bigger narcissism than you do. So like, he's had to kind of pull it back. And at the same time, the more he gets to stay in the role and point to things he delivered to a movement, the more he's going to try and come out and harvest in 2028. So I actually think he's, just by force of having to hold the job, I think he's going to try and pull back. I hope I'm right, but could be wrong.
Well, in Maha, Maha won MAGA the election too. And so keeping him on at least till the midterms, I think, is going to be really important to MAGA. But
the other question that nobody thinks is, if he were to leave, who replaces him?
Oz.
You think so?
Yeah. For sure. I think that's deliberately why no one's attacking Oz. He's kind of doing his own thing over at CMS. I think he would be an easy shoo-in.
I don't know.
If I were Trump, that's who I'd
That's
do.
a whole lot of ashwagandha for everybody in the country. All right. So, before we bring on our guest who took a stand, and we're excited to share the conversation with him, Katelyn, where do we go from here?
I think that we already kind of talked about it, right? And like I said, I feel like I'm in the arena right now. Whenever I'm in the arena, I try to look out, and we're clearly at an inflection point in public health. Like, no question, we're at an inflection point. And at every inflection point, you need two things. If you're in the fight or if you're in the arena, right? You need a defense. And we need a defense so we don't move backwards, right? So you don't take a 180 move the wrong way. And this is, born out of fear and frustration. I also think, though, you need an offense. And we need to provide an alternative path forward than either the one we're on or that we provided as the status quo. And with an offense, that means reimagining our systems. That means being very creative. That means being very innovative in these spaces. It means figuring out how to integrate. It's born out of hope, and it's born out of opportunity. And so, both of these are needed. Both, you need offense, you need defense. Both are necessary. But like I said earlier, I've been far focused on the latter.
Yeah. As you guys may or may not know, this is the last episode we'll be doing of the show for a while.
We're a little busy.
A little bit busy. And I'll also tell you that my current, can't call it a job, I don't get paid to do it, but my current day occupation has me traveling up and down the state of Michigan. And one of the things that I think we've taken for granted because we've been told it is that there are some people who believe some things and some people who believe others. And that's just a fixed way of the world. And that persuasion or conversation can't actually change anything. I'll tell you, a couple weeks ago, 2 weeks ago, I was in Houghton, Michigan. Anybody know where Houghton is? All right. Houghton is on the Upper Peninsula of the Upper Peninsula of Michigan. All right? And we filled a room up to have a conversation about health and healthcare. And these are folks you would assume would not agree with most of the conversation that we share, but they're also folks who got to wait 2,000 people long wait lists to take their kid to a dentist. And I think that we often pay lip service to the idea that public health is a way of viewing the world, that we can work together to build a place where we keep people healthy in the first place. But sometimes we give up on doing the work of persuading people that that is a thing that we ought to do. And I think the thing I'd be asking all of us is, how are we going out beyond the administration, beyond X or Y or Z or Instagram or whatever else? How are we breaking out of the algorithms that tell us what we're supposed to think about the world and engaging with people in their communities? Because I think in those spaces, there are a lot of folks who either believe in what we do or are willing and interested in listening. And I hope that coming out of conversations like this, all of us can be thinking a little bit about how we take these conversations into places that we might be uncomfortable. Because here's the thing, this is a pretty safe space, but the real world is not, as I hope current events has forced us to understand. But what you do in an unsafe space, that's the question of courage. And I know that the stuff that has moved us to be a part of this work, that's also made of courage. And so I think this is a moment for us, not just to take our anger to ourselves or to let it be relegated into the little networks that we share with people who think like us, but be willing to go and have a good faith conversation with the folks who are still willing to be good faith. And that's most people in this country. And if the 6 months that I've been doing this have told me anything, is that people are good. They really are good, and they want the good things. And there are a lot of people out there who engage in bad faith conversation, right, to try and convince people that the things that we all want that are good are not actually good. And it takes us being willing to be a part of those conversations, to be uncomfortable and unsafe sometimes, to have conversations about what we really want together. And so I hope that all of us will continue to do that. I hope that I'll get to continue to do that for the next year, and we'll have to compare notes on the back end.
Yes.
America Dissected is brought to you by ExpressVPN. Going online without ExpressVPN is like driving a car without a seatbelt. Even if you're the best driver in the world, would you really trust your life to all the other maniacs on the road? Every time you connect to an unencrypted network, in cafes, hotels, airports, your online data is out there for all to see. Any hacker on the same network can gain access to and steal your personal data. That includes everything from passwords, bank logins, to credit card details. It doesn't take much technology knowledge to hack someone. Just some cheap hardware is needed. A smart 12-year-old could do it. Your data is valuable. Hackers can make up to $1,000 per person selling personal info on the dark web. ExpressVPN stops hackers from stealing your data by creating a secure, encrypted tunnel between your device and the internet. I've been using ExpressVPN for years, even before they became a sponsor. That's because it's super secure. It would take a hacker with a supercomputer over 1 billion years to get past ExpressVPN's encryption. It's super easy to use. You just fire up the app and click a button, and it's up. You can use it on phones, laptops, tablets, and more. All for just $3.49 a month, 12 cents a day. It's why it's rated #1 on top tech reviewers like CNET and The Verge. I literally don't leave home without it. No matter where I go, I know I'm protected because I've got ExpressVPN. Secure your online data today by visiting expressvpn.com/dissected. That's expressvpn.com/dissected to find out how you can get up to 4 extra months. expressvpn.com/dissected.
All right, so it's time for our guest, who is somebody who understood sometimes that bad faith is bad faith and you've got to take a stand. Our guest today is Dr. Peter Marks. He spent more than a decade at the FDA, rising to become the director of the Center for Biologics Evaluation and Research. He's now the Senior Vice President for Molecule Discovery at Eli Lilly. This commentary today is being done in his personal capacity, and he doesn't speak for either the FDA or Lilly. So please give a warm welcome to Dr. Peter Marks. Dr. Marks, thanks so much for taking the time.
My pleasure.
Let's jump in. So, we all heard about your courage stepping up for the sake of the science, early on in under this current RFK leadership of HHS. And for anybody who might be unaware of your story, you left the FDA in March, and you were the first high-profile forced resignation, which sadly became a sign of events to come. Needless to say, public health right now is in a really fragile moment. I want to ask you, in your understanding, from your perch at the FDA, how did we get here?
So thanks so much for having me. I think we got here through, and I think you already mentioned, we got here through about a decade of a confluence of things coming together. A society that doesn't really value caring for each other anymore, which is just the truth, right? People would like to do their own thing. They don't worry about getting vaccinated to prevent communicable diseases going from them to someone else. We have the rise of social media, our own, these things let you get into yourself. You can live in your own world, right? These things, rather than doing what they were supposed to do, if you actually read some of the things in the 1980s, they're supposed to make us all feel together. Instead, what they've done is they've made us all driven apart. And then on top of that, I think we've had the ability, and this came about during the COVID pandemic, of influencing large numbers of people by taking a stand on facts that was not truthful. And unfortunately, all of those things we were unprepared for as public health professionals, because most of us we were told, you do the right thing and you tell the truth, and that's supposed to do it. We weren't trained as communications professionals to get out messages. We weren't trained to deal with misinformation coming at breakneck speed. And we never thought that we would see, both sides of the aisle have a collapse of support for the truth.
What I have realized is this rise of this curiosity-driven class. And just so many people have questions and concerns and confusion. And you're right, we're not trained in it. Abdul, you're an incredible communicator. I don't know where you got training, but I had to learn about it on the fly. I never got 1 hour of one course of communication. Raise your hand if any of you guys got training in communication and public health.
Okay, all right.
Wow, I want to know where you guys went. Not my school. But, I think that it comes down to what are the core capabilities of public health. And one of them was, very much ignored communication.
I think the other big piece of it is, I think we tend to think in a mindset driven by the academy and academic culture, which is the more time you've read stuff or thought about stuff, the more you know. And people will implicitly listen to the most educated person in a room because of their added degrees. And that's not how the world works. And so we tend to communicate to the broader public as we would communicate in an academic frame, which is to say, I have many degrees. I've spent a lot of time learning. You should listen to me because I know more than you, which is not a really great way to talk to people, because they'll assume that you are condescending them, which you actually are, right? And so we assume that people will listen because somebody may have spent more time thinking, is a quote unquote expert. And then the other problem that I often find is that we treat science like dogma. Science is not dogma, right? But you think about the implicit comparison that a lot of folks make to how expert scientists talk about science, which is how priests talk about faith. Which is to say, the Bible says, right, or the Quran says, or the whatever says, right, and they are now the arbiters of the holy book. But the thing about science is there's not a holy book. It's a process of asking questions and answering questions, and that process itself is what you can become an expert in, but not the answer to the question. And I think the problem is we've actually backed into thinking about science like priests think about the Bible, which is telling the wrong story about how science actually works. And I think that's part of like what's left. And to your point, I love that point that you make about social media and the algorithmification of everything, and the notion that like we are sucked into algorithms we don't even know exist. I want to ask you particularly about this administration though, right? When did you see it coming to a head? Like as you're watching this, it's like, let's just say it's like November or December of 2024, and you're like sitting in your office being like, oh, WTF do I do now? Like how did this all happen in your mind?
I think it was, just so we understand, the people in public health in agencies like FDA, CDC, we actually don't identify, many of us don't identify as R or D, but we actually identify as people who care about public health and work together in that. And I've worked with people on both sides who do the right thing. That's the right thing, right? We care about public health. But I think what became clear, it became clear after November that there was, I think the anxiety level kind of went up, right? It's like,
you think?
The tiger, well, no, but the tiger was still not right in line. It might have been in sight, but it wasn't in striking distance, because there were people that could have been made Secretary of Health and Human Services who actually were reasonable people who actually believe in, public health and public health priorities. Unfortunately, I think then as we saw this go into December, January, and then we saw the confirmation of the secretary and his words, and frankly, the norms that have been shattered. I've testified before Congress multiple times. I would never raise my voice to, this constant raising voices and hurling at senators and congressmen that are congresspeople that we see. This is just such an unheard of thing. So we've witnessed this, and I think that once we started to see that, I think the writing was on the wall. And also we could tell from questions coming in to us, these were like, Dr. Marks, how often do you beat your wife? And do you use a hammer, or do you use, it was like, these were not questions about, we actually, and this is verifiable by the record. We tried to, when Mr. Kennedy came into his role, we tried to explain to him, look, we want to have a dialogue. We'll show you what vaccine safety is about. We'll show you how it's done. We'll try to explain theirs. Honestly, theirs needs you were talking about do it better. Theirs is not actually transparent enough for the world today. In a world of social media, we could do it better.
And it's clunky. Can we fix this data?
Well, yeah, it's clunky, but we have these things in the United States that people also hold dear called privacy.
Yes.
And
What
in order to, it's a concept that we want transparency, but we also want individual privacy, and that's what the system is trying to balance. We need to figure out how to do it better, and that's what we offered to do. But I think, look, this was not about making a better VAERS. This was not about understand. This was about an agenda against vaccines, okay? And it is an agenda against something that I think we just have to stop. I've just stopped certain things, which is that, yes, it's okay to have a conversation about the benefits and risks of vaccines. We have to do that. We're going to have trusted people. They don't have to be learned people, but trusted people have that conversation. But I think at a certain point, we are going to have to say, look, here's our base. We base things that we believe in, and I think we believe that well-crafted vaccines are important. The idea that it's a good idea to stop vaccinating dogs and cats against rabies because, well, I'm worried that they're going to affect my dog or cat adversely. I mean, are we out of our minds?
Yes.
We are. Yeah, no, because this is like, I feel like if this was like slapstick, someone would just come along and just you wouldn't even have a conversation. You just slap the person in the head. Are you crazy? You want people to get? So now we're at a place where there are real consequences. This year, additional people will die of influenza because the influenza vaccine rate, at least as of this point in the season, is dismal. Okay, and if you look at COVID, it's all the vaccination rates, and you don't have to listen to me. You can actually look at the manufacturers whose results are doing their financial results are doing pretty poorly, which reflects their poor sales. It's just really at a place now where I think we're going to see the consequences. And the consequences may finally, the terrible thing that I think of as a public health professional is when I study public health over the past 120 years, the way we end up, I'm not 120 years old, but when you look at it over the past 120 years in the United States, the only way we come off of the precipice like this is through a really good catastrophe. A bunch of kids die, a bunch of really bad things happen, and then suddenly people wake up and say, wait a second, we got to do something differently. And I think it may be that the wake-up, unfortunately, the wake-up call, which I thought would have been thousands of kids in the United States having measles, which that would have, I thought, or even one or two deaths would have woken us up. That doesn't seem to have done it. Losing measles elimination status, which we are going to do in January. Canada is there now. The WHO will meet about that, and we'll see what happens here in the United States in January.
I agree with you. We are going to go backwards before we go forwards again. I think the big question is how back are we going to go? And public health is not taking this lying down, right? You made an incredible exit. Susan over at CDC made it an incredibly courageous exit. Dimitri, Deb, all of these leaders. We have the Vaccine Integrity Project that was launched. We have states banding together to implement their own vaccine policies. Do you think that these pockets of resistance or defense are gonna hold in the next 3 years?
I can't predict because I think it's going to depend on too many factors that are beyond my control. I think at least if we stay on the path we're on now, I'm very concerned because I think that many of the controls that could prevent disaster will not be there. And I also think I'm sorry, I'm mortified by the controls because the controls are that we're going to be okay in the mid-Atlantic and in the Northeast and in parts of the West, but the rest of the country is hosed.
And diseases don't care.
That's not okay. That's not okay because as a public health professional, maybe it's also me as a federalist, but you want a person in Massachusetts and a person in Mobile, Alabama to have the same basic level of public health. And that's the right thing, right? And I worry that we're getting to a place where, yes, we're putting in things that will make it so that in the Northeast or the Mid-Atlantic we'll do better, but it's a small consolation for the fact that there are going to be many people in this country who will suffer needlessly because we're not seeing the right responsibility taken at the federal level to bring up it's not that states can't have, the whole point of a good federalism is that you create a floor, right? Everyone needs to be able to have like food on the table, perhaps. And then if some states want to like have something plus, that's fine. But that's what worries me is that, I just don't know where the floor is. Now, things could change over the next years. And I do believe that they, in the brighter scheme of things, something will change in the next couple of years. And hopefully we'll see the rebirth of public health. But in what it can accomplish. But right now it's pretty dark, and I'm not sure that it's not going to get a little darker before it starts to get light. I don't mean to. I'm not sorry, not trying to depress anyone here, but
Abdul looks really stressed over here.
I mean, here's the crazy thing for me is this. Vaccines, like the same people who oppose vaccines are out here talking about taking, like, you name the peptide, right? Like, I live in these, unfortunately, I spend way too much time in these algorithms, all right? Like, I get pitched Maha content all the time, right? Like, I'm a certifiable gym bro. I wear that badge, like, with honor. But the number of accounts that you get that are like, well, you shouldn't take these vaccines because they'll hurt your gains. But also, here's this peptide that has zero research behind it, but there might be one paper in rats, which you are going to inject into your body with zero evidence. To me, it's just like, wait, so the issue isn't that you're injecting things into your body. The issue is that the scientific establishment has done a whole lot of research to prove that injecting it into your body does more harm than good. But there's this other thing that's only been tried in rats, which you promise me, right, is going to grow my biceps by a whole inch. And somehow, that's more important than protecting me from flu and measles and mumps and rubella and polio and COVID and all the other things. Like, how does this make sense?
Yeah. So Abdul, you just got to the heart of one of the great problems here, which is that this is really the heart of it.
That's like the heart of the problem.
No. The heart of the problem here is that ethically produced pharmaceutical products like vaccines go through a thorough scientific process, and you know that, like everything else in life, there are benefits and risks. And because of the way we do this process, you can actually enumerate the risks. And what has happened is those who want to put forth wellness products, they don't worry about risk because most of them have no activity anyway, right? Let's just face it, right? Many of these things, when they're at their best, they actually have no activity, but they don't cause harm. At their worst, they have no activity and they do cause harm. But this is they don't worry about the negatives, right? It's just they're selling because they're not regulated. If these things were regulated, they would actually have a list of the harms they have, including the financial toxicity that they cause people that pay out of pocket for them. I know my kids sometimes buy these things, and I find them around the house.
How does that make you? Wait a second. What? This is the revelation of the whole.
Yeah. No. But this is the problem: is that you have this. It is essentially a disparity between, or a gulf between real pharmaceutical products and wellness products, or things that claim to make people well. And on the one hand, you have to say all of the bad things that go along with them, and the others, you don't need to, right? Because and this is what is leading to this focus on, when you listen to a lot of the anti-vaccine stuff, you hear all about the negatives, right? You hear all about the kids who are supposedly getting encephalitis from the measles vaccine, which, by the way, measles vaccine does not cause encephalitis. On the other hand, measles does, and it also causes late encephalitis. You don't actually hear about the fact that, if you get measles, there's a 1 in 1,000 chance the child will die of measles, and that you're preventing all of those. You don't hear about the fact that outside of the United States, where measles vaccine is in scarce supply in Africa and Asia, 100,000 kids die under the age of 5 of measles. You don't hear about that, right? Yeah. But you do hear about these other issues like, oh my God, your child could have, a fever. And it's true, here's a great example of where we don't do a good job. We don't do a good job telling parents, take your kid's temperature a week after they get the measles vaccine, and if they get a fever, God forbid, give them some antipyretic. God forbid you give them acetaminophen. Yeah, don't give them that. Don't give them that. The end of Western civilization is going to be based on that drug.
You get not to take it.
Anyway. Right. But that's where we could have done better. And this is a good example of places where we could have done better.
I will say this, the MMR vaccine does nothing for gains. But I do want to ask you on something. I had a revelation during the pandemic from a gentleman with whom I was sharing a conversation about insulin. So he's like, Doc, listen, Like, I know you, I trust you. If you say I should take this, I'll believe you. But here's the problem I got. Y'all are trying to push this vaccine that didn't exist a year ago for a disease I don't have that didn't exist a year ago. And I can't afford my insulin, which is a medication that's been around for 100 years, for a disease I know I have. So it's nice that you're all out here right now trying to get me to take this vaccine, but where were you when I couldn't afford my insulin? Yeah. And I raise that just because it does speak to the other side of the pharmaceutical issue, right? For a long time, the very same corporations that manufacture ethically and responsibly our vaccine supply have also opted to press their opportunity to extract more for the medications and the vaccines they make. And it does deeply shake people's trust because it then undercuts the idea that this is in the public's good when they so clearly see the pharmaceutical companies making so much money. And this has been something that RFK and others have really pushed on, right, around this issue that we can't trust these companies. And it's hard for me because I've been one of the biggest critics of pharma. It's just, for me, the issue is not that they make things that are bad for you. The issue is that they make the things that are good for you too expensive so that by definition you can't afford them. And you can clap for that. So I want to ask, because I know you're now in a different role, and I want to ask you how you think about that, how you square that, right? Because it is a part of the problem, right? And if we don't address that issue, I worry that we're going to continue to have to work uphill to get people to trust the pharmaceutical industry, which we require to make the things that we need, like vaccines and other medications.
Yeah, no, I mean, it is clearly an issue, right? I mean, not thrilled about the cost of drugs, and I'm not involved with drug pricing, but it is one of the fundamental issues that creates this tension here, right? And hopefully, there will be efforts to, control things. Unfortunately, there is this crazy problem we have in the United States, which is that financial incentive has also been why there's been so much investment in drug development in the United States. It's just a fact that that's happened. Now, I'm not sure that the profit margins, my present employer probably, I'm here on my personal capacity, probably wouldn't love this, but I'm not sure that we need to see the margins that we're seeing in the United States because other countries won't accept these margins. But this is something for society to determine. But I just want to answer you on one thing, though. Yes, the pharma companies are bad, but at least they make things that actually have intrinsic value, as opposed to people who are selling things that don't necessarily have any intrinsic value, that many people are paying for out of pocket completely, right? At least many people at least get part of their drugs. Not everyone, but they get part of their drugs paid for, whereas you're seeing people paying out of pocket incredible amounts of money sometimes for things that have really no basis. I can tell you when I was center director, I would occasionally get these notes from people, and I get sometimes handwritten notes. People actually still and you could tell it must have been someone kind of on the older side because it was in cursive handwriting.
Was good.
Yeah, and it would be, I spent $20,000 on stem cells to try to help my husband who can't remember who I am anymore. And after he got them, he still couldn't remember who I was anymore. And they told me it would help him. That's what's going on. That to me is, and those were unapproved, et cetera. And so not that all of these are quite that bad, but this is, so I agree with you. We got to fix the pharmaceutical industry, but we can't point over there and say, oh, this wellness industry is an alternative that's going to fix things, because it's not. It's actually just going around the process and making people pure profit because they don't actually have to do the work to show that the stuff actually, A, works, and B, they don't have to study its adverse effects.
Yeah, and I think, one thing that you brought up, Abdul, about this diabetes versus COVID thing, is real, right? It's us in public health because of our funding streams showing up during emergencies and then retreating during peacetime. And so figuring out how to survive this panic or cycle of panic and neglect, how to be responsive to the needs on the ground beyond what we think is important in the moment, which is COVID, is sometimes is very different to what's important to the community. And I think staying grounded in that is also, needs to be front of mind. How you do that, we can figure that out later. But I think that that's really one of the keys right now.
Yeah.
I will say also, to back off on that conversation, one of the cool things about public health degree is you can do incredible things. Like all three of us are doing very different things. We have someone working in the state of Michigan. We have, I have a for-profit company now. And you, congratulations on your new role over at Eli Lilly. I think, though, one of the challenges that we continue to hear right now, particularly from MAHA, or a criticism, is like this revolving door between public health and private industry. How are you thinking about that when you took this role? And are you going to go back to government, or what? What are you thinking?
So let me just first of all, there's a lot to unpack there. So
I know.
Let me start unpacking.
Let's go.
Let me start unpacking with the fact that, first of all, at FDA, the back and forth between industry and academic medicine and FDA, between all combinations thereof, was probably one of the most healthy things we had, because people who were in industry understood actually how drugs are manufactured. And I never sat in a meeting in 13 years at FDA where I thought someone's industry background actually biased their in a pro way. In fact, most of the time, it biased like those guys are, so that's number one. Number two, so what about me? So look, with all, when I left FDA, there was a lot going on. It may be that I did look for jobs in other sectors. And it may also be that in this environment, there's no jobs. Or if you leave and you're at a certain level, it's actually hard to get a job in a school of public health or in a medical school, because people did not. Think about what was going on in June, July of this year. Certain academic institutions were being targeted for diversity or other issues, and so it was a challenging job market. And so I actually feel very grateful that I'm able to actually be gainfully employed, potentially helping bring forward genetic medicines and infectious disease products towards to benefit of people. But I'd rather be back actually making sure public health was moving forward, and that's where I may find myself in the future. But we just don't know. Again, the crystal ball right now is very challenging.
See, and this is what gets me right now in this moment, is that they have this expectation you can't go into private industry, and fine, but then do not take away all of our funding for research. Do not take away all the infrastructure for public health.
Look, they wouldn't have been happy wherever I went, right?
That is true.
Unless I went, someone actually said it right. Maybe if I sold used cars, they would have been happy, okay?
I feel like, like the March lockdown.
Right,
like,
yeah.
I'm just saying.
Maybe I could have gotten a spot on the White House lawn, pretend those big American flags, use Teslas maybe. Yeah.
Look. Wow, Dr. Marx just came for Elon Musk.
Sorry.
I love this. All right. I wanna just move looking into the future, right? It's hard right now to imagine a future public health that operates in I don't want to say bipartisan because it's too political, but with the consensus support of the vast majority of the American public. And I guess from where you sit, as somebody who's spent your career trying to make sure that the vaccines that we are deploying are safe and effective, what do you think we need to get right to get there, right? Because we're in a place now where we are usually really good faith people, and we respond to deliberate misinformation by let me clarify, right? And it's just not good faith, right? So what do you think we need to do to architect the kind of conversation and ultimately the kind of government agencies that deliver on the purpose and the need for public health, which you really eloquently articulated, what's the pathway from here to there?
So maybe at the risk of being a little bit controversial, I'll say we're going to have to become transparent enough, clear enough that sixth graders can become our public health emissaries. And that's really going to be it. No, I mean, I think we're going to have to be clear enough about what vaccine safety is about, that these are incredibly safe products when used appropriately, and that they have real benefit, and we can show that benefit, and we can actually, you can explain this. If you can't explain it to a sixth grader, you can't explain it. We don't understand it well enough yourself, and we don't have a system that's clear enough that you can actually show the few people over here that are harmed potentially by vaccines and the large auditorium over here of people who were helped by them. And so I think we're going to have to get to a place of being able to explain it very simply, clearly, and have something like an army of sixth graders. I'm not picking on sixth graders, I apologize. But be able to have a group of people that include trusted messengers in given communities. In some communities, those are going to be people who cut hair, okay? And by the way, I'm not kidding about that, because during COVID, there was Reed Tuckson was able to get the Black community, right? Barbershops, that's how you got barbershops. And it may be in other communities, it's going to be book clubs. In others, it may be houses of worship. But we will need to have this essentially get to places where the conversation can happen with people who are trusted. And those trusted people should be able to access the information in a way that it doesn't require degrees to actually understand the vaccine information if it's put in appropriate terms.
What I hear you saying is that we may not be our best messengers. And I think that's a point of humility that all of us ought to accept, right? And I think the faster and further we offer this message for people to put it in their own words for their own purpose, I think the further the message goes. And I think that's actually the really important point. I think sometimes, right, we think we need to defend ourselves. And I actually think that there are enough people out there who want to defend us that if we offer that and just be like, hey, your future to dictate and build, I actually think we're going to find a lot more folks who want to step in for that. This was an amazing session. If we can have a round of applause for our guest, Dr. Peter Marks. And a big thank you to all of you for coming out today. We really, really appreciate you being a listener and a follower of the show. And we're grateful for your time today. Katelyn, as always, thank you so much.
Yeah, thank you. See you guys around.
As you all know, this is going to be the last episode we do for a while as I take a pause to focus on my campaign for U.S. Senate in Michigan. Bringing you this podcast every week for the past 6 years has been one of my great joys. Thank you for listening. I hope we've offered some perspective and some hope at the edge of what have been some of the most consequential years in public health and healthcare in our lifetimes. Before I leave you, I want to share one last thought. The world is what we build it. I think a lot about that Martin Luther King quote that President Obama would echo. The arc of the moral universe is long, but it bends towards justice. There's one part of that I have to admit always bothers me. The notion that it bends on its own. It does not. We bend it. I hope that as we watch the dissolution of so much we hold dear, we don't give up on playing our role in bending it. I'll be doing that in my own way, and I look forward to what you, each and every one of you, will do to bend it in yours. And let us always believe that it is that striving, that effort, that work, done together, that bends that moral arc towards justice. That's it. Our merch store will be open through the end of the year, so it's your last chance to get your official America Dissected merch. If you want to continue to follow my work, follow me on Instagram, TikTok, YouTube, or X at Abdul and Katelyn. No dash. And make sure to subscribe to Katelyn's incredible newsletter, Your Local Epidemiologist, which breaks down the latest scientific evidence for over 300,000 readers. Search for Your Local Epidemiologist on Substack. Links to all our sponsors are available in the show notes. I really do hope you'll check them out and show them some love. They make the show possible every week. So, for one last time, for now, America Dissected is a product of Incision Media. Our co-host is Dr. Jetelina. Katelyn, thank you for joining me on this last and most boisterous leg of this. Your contributions have been incredible. Our producer is Andy Gardner-Bernstein, the one who always has the kind word and a frame that captures the most important piece of a story. Video and audio editing by Nadine Melkonian, who always made us look and sound our best. Our theme song is by Taka Suzawa and Alex Sugiera. And y'all, the theme song really is a banger. Sales and marketing by Joel Fowler and Nick Freeman at Big Little Media. Thank you guys for keeping the lights on. Our executive producers are Tara Knight. Tara, thank you for everything, for keeping the trains running on time, for keeping me on track, and for always being the rock behind this and so much of the work I've been able to do over the past nearly 10 years. And finally, as your executive producer and host, I'm Dr. Abdul signing off for one last time. For the past 6 years, thanks for listening. This show is for general information and entertainment purposes only. It's not intended to provide specific healthcare or medical advice and should not be construed as providing healthcare or medical advice. Please consult your own physician with any questions related to your own health.